Abusia for me ma munyina achen impre no so de ba bedwam dwumadie so. Osoma hodo ne dwumadie ahodo a ewo bedwam dwumadie mu se de yasese no wo munyina e de aba besom nti ye do mase. De adru so eye Afisem enkomo twetwe na enura ne yedi nkomo bi wa ha efa ye nua ma ne ho ehwe ensabuo ho nsem ye de ani akere mema no so because etire ni nyina akɔwie mema no na mema no wo mu yetire na so wo mase ho no asam kɔba ho a na no so ama bibia ho bi so atiase wo hu ne mepa kire dadada so ho enti eno ne yenkomo a ye baba bedi e wa hanom se na yenkomo die nim no ye bepoto kakra ye beka brofo wo hwe bedwam so ye ba beka brofo mesraw biewasum ema me na me wani ni yenkomo twetwe na chi na so me hye obo se ye beda ne de abaye dim kakra bi na ma wo hu nkomo potia ye ba bedi na mom komo no tofa bom lo kowie se eye emema eho asem enkomo na ye ba bedi na me bo amane se wo asantemantam osai kroma bonten so ahin kro kumase a eye kumase West Hill small eho ena bronye wo kwa akodidwa no edwa bia se wudi ma enika ne enije befie na ho se wudi bronya wo breko a wonko chinchin dwa so bebre nsaimra eno a ne kumase West Hill small enti fo ani kire honom na akoto bibia wo pe afei nso me bo amane wo Afisem so se abusua mo apomuden ho nsem enhian no apomuden ho nsem nso ebehia wa na eye Dominion herbal powder sa powder ya make ho asem akire wo de fa ne se opasem what to say maka but fa ne se wo pasem keke e na wo kwa kotwa sa tii bi na ade wo twa tii na nopa na asanom na nwumre ka ho a frɛ numbers ne do ma say because ebebo apomuden prekope entwen nyare ansa we ye de abre bia obetumi aye oti kakra bi wo de benom ba akwa bi ya besa akoye yi de ade na wonom Dominion herbal tea what you say na wo fa enhwehwe apomuden akiri kwan wo numbers no eye 0543 158 195 0543 158 195 and 0204 296 449 Dominion herbal powder nombi twati na etumi mwa immune system no nenya apomuden amapa anope wo bi epese wondum TV no no nkwa adwuma fi se wo hwe diamond saa wo ya late there bi enya saa wo ya late nso no ankwa adwuma no nso wo ha foforo de bebe fie enti unim de obeye eno ane se wo fresh number si 0302 225 651 tieni you 0302 225 651 and 0546 133 188 wo fresh numbers ya eye francofo na wo frɛ wo mo be ma phone papa so ate ase wo hu na ma wo tike mu kwadwuma nyina o drive a wo nka ho mpacho so ate ase anakoduru adwuma mkura wo phone yisu na ne wo hwe bedwam saa so hu na wantena fie ahwe TV ama wanye late wo pe TV so wo adwuma mu anasa computer sa bibia e fa saa ne ma hu ide eye Franco Trading Enterprise anope wanda romanti ye ba bedi enkomo na Afisem enkomo twetwe wo bedwam eno so na ye dumadi kan bo amane dada sa no pe ye poto na ye poto na mene Dr. George Harmis na eba bedi sa enkomo yi yenkomo die no efa emema eho asem enti Dr. wo menten a oba beboa ye na ye de sa yenkomo. Dr. George Harmis, good morning.
Good morning.
Please, how are you doing?
I'm doing fine.
How are your staff and your patients?
They're doing well.
We have heard that you haven't been in Ghana for a long time, but you've been helping our men concerning prostate.
That's true.
What do? You are a urologist.
I'm a urologist.
What do you do as a urologist?
The urologist is a doctor that specializes in treating diseases in the urinary tract in both men and women. And when I'm saying urinary tract, I mean diseases of the kidneys, the ureter, the urinary bladder, the urethra. But in men in particular, we're treating diseases regarding with the reproductive system of men.
Okay.
And this includes the testes, the penis, and of course the prostate.
Okay, and we really have interest in that because we the women, if we can get our healthy life, our sexual life and our children, it's based on you the men, and concerning the prostate, whenever it gets fault, then we women at fault. So we don't want that. So good to have you that you're in Ghana and helping our men concerning their prostate. So what actually do you do? And okay, you have told us about that. So your hospital is what?
LuccaHealth Medical Center.
LuccaHealth at where?
We are in East Legon.
East Legon.
We have two campuses.
Okay.
Our main campus is It's at Massery Avenue. It's very close to the Grand Meswick Hotel. At the same campus, we're together with MDS Lancet Laboratory and with Quest Medical Imaging. And this is very good for the patients because all of our patients that get a consultation with us, at the same time, we can send them and do their laboratories and their imaging studies at the same place.
Okay.
So they don't have to go to different places. It's not about
go here, do that, come back, and you have everything at your facility that you are helping.
Exactly.
them.
And also the fact that all the doctors working in our center, we are working only there. So our patients can find us every day from Monday to Friday. We're always there. And so it's very easily accessible for our patients. We have also a second campus, also pretty near to the first one. It is in Justice Sowa Avenue. It is together
Justice
with
Sowa Avenue,
together
in
East Legon. Together with Acacia Medical Center. This is the second campus that we operate. Okay.
We've been hearing all the time that this prostate something is really a big problem with our men. So most of the men, at what age and what symptoms that you know that have started suffering from this prostate or prostatic something?
So the basic two diseases that all men are interested in with the prostate is first of all the enlargement of the prostate, the BPH as we say, the hyperplasia. And the second one is the prostate cancer. These are the main two disorders that we're dealing with.
Dr. Joy, please hold on. You just mentioned something. We have prostate cancer and we have prostate what?
Prostate enlargement.
Prostate enlargement. Oh, okay. And the cancer. So there are two different here.
There are two different diseases.
The prostate cancer and the prostate enlargement. Please take us through.
They are different, but they have some common things. I mean, for example, both of them, they present as we grow older.
Okay.
And but they have, of course, a different course. For example, the enlargement of the prostate, it is very easily identified by the patient themselves as they realize that the quality of the urination is changing as they grow older.
And it's becoming big.
The prostate is getting big and it's squeezing the walls of the urethra from where the urine is coming out.
Okay, and so that's what we can see on our screen, right? What's just appeared?
Exactly, yes. On the left side, you can see a normal prostate, and the urine is passing through it. And on the right side, we see an enlarged prostate that has this nodular appearance. And as it gets bigger and bigger, it's squeezing the urethra and the walls of the urethra, making difficult for the patient to pass the urine. And this is the first symptoms that the patients experience, and that's why they're coming for us to make a consultation and evaluate their symptoms.
Okay, I see. Abusiafo yankomo a yedie no efa yenuanom emema ho mo prostate no metre mo hwewa no ho asem no se ebia eye kese ekwan ya befa so a obehu enema bia ebe obehu ho sunsuanso woni padua ni wa behu se ensakraye ebem eno na Dr. George Harames eboaye ama wo ho bia na wo sa ha no na chiri kwan no ewo East Legon se de waboso achene mo ya sabia ne di no eye LuccaHealth into Shannon so now call East Legona na wahu me ka LuccaHealth oboni trinku eno anote ase but ye nkomodie na say yenuano mema na ye dwendwen omohom. So there are some people maybe they will see by the time they will see the enlargement of, is it their testicle or what?
No, it's something they can see it because it's within.
Okay.
As I said before, the first symptoms they have is they have some obstructive symptoms. For example, they have some difficulty starting the urination, or it takes a long time to empty their bladder. Sometimes they stop and they need to start again the urination, and in general they feel that their bladder is not emptying properly. Also, they have some other symptoms. For example, they may have frequency. They want to go very often to the toilet, and sometimes there is also urgency, which means they're not able to postpone the desire to pass the urine. And another very important symptom is the so-called Nocturia symptom. Nocturia means that these patients tend to wake up at night because they need to go to toilet to empty their bladder. And this can happen many times during the night, and you can imagine with all these symptoms how much the quality of life of this patient is affected. So
when a man starts seeing all these symptoms, it's especially those who cannot sleep in the night and they frequently go to the washroom or something, it's not because what they ate last night is disturbing them, especially when it continues for some time. Okay, we understand. So at what particular age that a man can experience these symptoms of this prostate?
Usually the symptoms appear at the age of 50.
50?
Most of the time.
50?
50.
Okay.
At the age of 50 is where we start having some symptoms. Just to give you a small number, from between the age of 50 and 60, almost 50% of men might experience some symptoms because of the enlargement of the prostate.
Okay.
And this number, it jumps to 90% when we reach the age of 80, 85. So it is completely an age-related situation.
So the men who are below 50 years are safe from prostate?
More or less, yes. From enlargement, yes. But we have also to consider that, in general, men supposed to come to their urologist the same way you women are going to your gynecologist. Because we know the men are not so eager to visit the urologist unless they do have symptoms. But I think this is a very important message to pass to our viewers here, is that the urologist is a doctor that needs to be visited at least once a year, and this can start at the age of 50. But for some people that they have a family history, some relatives, first-degree relatives that they used to have problems with the prostate, it's better this screening to start at the age of 45 to be on the safe side.
Okay. So this is the opposite side of the women. When you see disorders in your menstrual cycle, which can lead to, what do they call, the fibroid or something, that it's the opposite side of the men, that they also see these things in their body system. Okay, there are some people, as we are even here discussing this, they have seen these symptoms in them, but maybe their affordability and what they have heard about, if I go this, they will do the cesarean section or what, the operation or something.
Okay.
What are you telling them?
First of all, not all people need to be operated, because this is a misconception. Because we can help the patients initially if they have some symptoms. We can give him some medications, and because the changes are very, very slow and they're happening very, very slow, they can stay for a medication for a long time without necessarily needing an operation. But for those who have taken already the medications, or for some people that they have severe symptoms, for example, patients that have reached a stage that cannot pass the urine at all, a condition called urinary retention.
It even got to that point.
Exactly.
That they can't even pass out urine at all.
Yes, a lot of people, they find out this problem suddenly when they're not able to pass the urine at all. This is an emergency situation because the patient needs to go to a healthcare facility in order to put a catheter to drain the bladder. So for these people that maybe the medical treatment will not be sufficient, yes, of course, in this case, we can consider doing a procedure, a surgical procedure. But nowadays, this procedure has been simplified a lot compared with the previous years. And we're very lucky at LuccaHealth, we can provide this kind of treatment in a so-called minimally invasive way. Minimally invasive way means without an open procedure, without any cuts. We can do the whole procedure through the natural way, through the urethra. We can go inside the urethra with a special scope. And we can see here.
So this is what you are talking about.
Exactly.
Right? Then at that, what you are talking about, then this is the stage that the person has reached concerning the prostate issues.
Exactly. So we go inside with this camera, and you see outside from the camera there is a laser fiber that comes up, and the laser fiber, what it's doing, it vaporizes the prostate. But the most important advantage of this technique is that at the same time it causes a coagulation around, so there's no bleeding, because in the past these operations used to be very, very hemorrhagic. The reason was that because of that was the kind of energy we used to use in the past. But the last few years we're lucky enough to have these brand new techniques, and now this is a one-day surgery basically. Patients can come in the morning, we can do the procedure, we can monitor them for a few hours, and the very same day they can return back home.
Oh, really?
Which is huge difference compared that a few years back people used to stay in the hospital for a week or so.
I'm surprised you are saying this, that you can do this for someone and the person can return home the same day.
Absolutely, absolutely.
Really?
Of course, he has to go back with a catheter that he needs to keep it for a couple of days, but he can come back after 2 days, and then we can remove the catheter and he can pass the urine freely. And especially now that we're in a COVID time period, I think this kind of approach is even more important, because the patients need to stay as less as possible within a healthcare facility, no matter the measures we take. And we take some very strict measures. For example, we don't proceed to an operation unless the patient has been tested for COVID. But still, I mean, in these times.
So if someone is listening to us and is in this prostate situation, LuccaHealth is ready to assist that person to free himself from this.
Absolutely, absolutely. Okay. We have all the necessary equipment.
What I'm really proud of is what you just told us, that the person can come for this catheter operation or something and can return home the same day, which means you have your modernized and technological way you are using at LuccaHealth.
You're absolutely right. I think we can do the procedure here the same way we would have done it in Europe or in the US.
Okay.
So, and that's very important, because I think the people must have this access to the new technology, and medicine is evolving a lot, and especially in my specialty, I can tell that it has really transformed over the last year because of this, the last few years, because of this emergence of new techniques that has changed the way we approach now the patients. And the less invasive for the patient means faster recovery, faster healing.
Fast recovery.
And I think the most important, the patients can return back to their normal activities very soon, so they don't have this feeling that, okay, I'm doing a procedure, I'm not going to go out for 1 month.
Oh,
and because also this has a psychological effect as well.
Sure. Sure. Okay. It's abusia yen come aye de ne nyina no ne tofa bom no ekowie se woye bema nko ade a Dr. George Harame Samayate ase se efimfrihie aduonum eko no de yade ne efre ne se prostate no obetumi anya bi na prostate no ewo mu mienu enlargement no wo ho de eye kese na cancer no ankasa nso ewo ho na emu bia ehaw bia no wo masuye no a efre ne se LuccaHealth ewo East Legon no ebetumi aboa ma wanya wapom den bia na ensunsanso ya wobobọ so nyina se uhu bi untimi na ojonso ntentem anajo ni nyina obejonso saa na bia sebio bema no ojonso ajonso ne ma emuye oyan kakra no bia wo hu saa senkyerani ni nyina na so wani nya ma wo so se eye prostate cancer na se prostate enlargement ana se prostate ni mu no na yare bi aba ho eno ho nkyerɛkyerɛ na one yen eye no anopenti o ma assurance no kra se emfa ho ne baabi a wo de na kwakodu no se catheter kra na ebehye wo a dano no ano wutumi esa akofie na se eye assured what ase enti eno ye nimde a won so e de aba beboa Ghana for enti eno ho nkomo na ye di no Afisem eswe. So Dr. George, please help us to know this. There are some people, all these symptoms you are talking about, they have seen it in their system, but they have been waited for years without even visiting the hospital. Those people, is it late for them?
No, it's not necessarily late. First of all, don't forget, men, they realize they have these symptoms, but they believe that this is something normal because they grow older. But in fact, this is not true, because we can definitely help them.
Okay.
And it's up to a urologist to evaluate their symptoms and give them a solution. I have recently seen a couple of patients that they were with a catheter for more than a year, and because they couldn't find a proper way to solve their problem.
Okay.
And they were a little bit concerned that even if we do the procedure, maybe they wouldn't be able to pass their urine easily after that. But thank God everything went well, and there is always a chance. I think
there's always a chance.
There's always a chance. And
so they should come to LuccaHealth to see you, to assist them, other than being in the house and giving excuses to their women that I can't perform, I'm tired, I'm feeling pains and those things.
Absolutely.
Those excuses doesn't help we women, you know, isn't it?
It's true. I know. It's not always easy for somebody to come to a doctor, especially older men. They're a little bit more reluctant. But I do believe that we can change the quality of life. I mean, even a patient that is with a catheter, I think he's feeling embarrassment. It's a little bit difficult to have a normal social life. So imagine the potential of this procedure to remove the catheter and have a normal, again, lifestyle like before. I think it can really help him. So I say that they definitely need to come to see a urologist, to make a complete urology checkup that needs to be done. Either they have symptoms or not, once a year.
Once a year, whether you haven't seen any symptoms at all.
It's true.
As a man from age 40, you have to see a urologist.
It would be very good. It would be very good. Because also, as I mentioned before, we were talking about only the enlargement of the prostate, but as I said before, we're also screening for the prostate cancer as well.
Okay.
The prostate cancer, in difference with the enlargement that we just discussed, is that usually it grows very, very slowly. And as long as it is inside the prostate, it doesn't cause any symptoms.
Okay.
And this is very, very important because it makes a big difference the timing that we do a diagnosis. If a urologist has a suspicion that maybe this patient has a prostate cancer and we make the diagnosis early, we can definitely provide him a treatment that has a very good possibility for curement.
Okay.
So that's why I'm saying that every year
you have to go for
men needs to be checked.
Okay.
And the doctor can do a very good physical examination. He can do all the necessary blood tests. We have specific blood tests that needs to be done every year for the cancer. And the way these tests are changing from year in, year out, the doctor that knows this patient well, he can understand if there is something going on.
Something else.
Exactly.
Yes, we get your points very well. So, dear doctor, and say we are bema crass. I didn't a friend say prostate cancer and I said prostate enlargement. You know, be na ebi wo na so sanso na wobobo so ni nyina no on se den hu bi wo ni peduane mu ehun be hia sa afi bia no wo de anya hwe kura no wo mra atai koneko ho urologist wo mo hwehwe sa na ema ni mu no wo mbeboa na de oni adaje kura no wo ye be ma afi bia wo de mfehye aduanan kono de kwaya sabia na wo monye hwehwe mu bia na esiewu ewo mu na mum ensunsanso no ena onhuye. Dr. Harris, let me ask you this. Just recently, the October month, there was education concerning the breast cancer, and we've been educated that men too get breast cancer. Initially, we thought it's that's for women alone, but we have learned that men too develop that. Some women also wake up in the night too. They will urinate and urinate.
That's true. That's true.
Do women also have this problem?
Absolutely.
Or prostate is only for men?
Prostate is only for men because it's a gland for men. But women have this condition that you just described. This condition is called overactive bladder. It means that
overactive bladder.
It means their urinary bladder, whenever they have a very, very small volume of urine inside the bladder, it brings an urgency, a desire to go to the toilet. It happens this condition very often, especially that women that have done a lot of babies in the past, they have labors, because the anatomy is changing a little bit, and the support tissues around the bladder are not the same, and as we grow older also they may get a little bit more loose. So this is a disturbing condition, but we have also solutions for this as well, because we see women as well. First of all, we can give them some medication that can really decrease the intensity of the symptoms, and because usually these women, they don't have it only at night, they have it only during daytime, and that is very, very disturbing for them. And most women with this problem with the medications are doing well, but for those who have this issue and they cannot be controlled at all with medication, we can also do a very, very small procedure, just endoscopy, so we can make injection of Botox inside the bladder. And this is minimizing the times that a woman can go to toilet.
So that is for women who have given more children, birth to more children.
Yes, and
what about those women? They haven't given birth to physically more children, but they have aborted several times. Won't that also affect them?
No, it can happen to them as well, but it's just more common to women that have done a lot of labors.
All right.
Because as I said before, as we grow older, also the tissues around the bladder and the urethra become a little bit more weak. Or I don't know if you have heard this condition that a lot of gynecologists diagnose sometimes. They have a prolapse of their organs. So this causes this kind of even incontinence or this frequency to the toilet. So in this condition as well, we can definitely help them. We can definitely help them not only with medication or the surgery, but also we can give them a lot of advices for their lifestyle and their activities every day, how much water they need to drink. And there are a lot of things that we can definitely help them.
So I was here, you come here, no, and Casancasa Fapem, no dear, a member who has some prostate who has some, and I can know you do cofa, man, who so crasse, say member to me, breast cancer, dear, any we know so a Martin Minya na doctor show you must say obadi onya prostate. Nemo no awododo okra no etumima ni pedua no how bem ai no so susanso na ya prostate fo ni nya no ema no so tuminya bintubo so no yire da ho na sesi ano o asore sesi ano asore so hu onya beifo bibi ne ha no na ebisa sa awododo nko a anaso obi ya abortion so dodo a otumi so kosa ha onime no so wachechem ti ne ti a watwamu ana se LuccaHealth no omo hwe ema ene emema. So doctor Doctor, we are ending our conversation here, and we are grateful for having you in Ghana to help our women and men, especially the men, because we need them for our sexual health, for our children, and for our pleasure.
Absolutely.
So thank you very much, Doctor.
Thank you so much for having me.
The location again, sir?
The location is in the East Legon. It's Maseru Avenue.
Okay.
It's very close to Lagos Avenue. This is our main campus, and we're operating, as I said, from Monday to Wednesday from 8 a.m. until 5 p.m.
Okay.
So our patients can call anytime our telephone center, and they can make an appointment.
And can we have the number, the telephone number, or we can have it on our screen?
I think you can see it on your screen.
Okay. So numbers no ebusia and a go screen is no 0544 120777 0544 120777. So far sa numbers here prostate ne hawa wa hwe environment no kra timu se owura hwa na ho ato baby wo ho no mo a owura na wo yare na dwane baby so hwa owura na yare no hu baby efi na ebia beka ho wo hwa ha yi a na chese wo kwa ye de beje wo because wo ho so beto so ahu into LuccaHealth Medical Specialty Center and our no. Doctor, yeah, that's so what I was saying is that if you even look at the facility, it can assure you that the moment you enter there, you get your healthy life.
It's a brand new facility, for sure.
Okay, thank you very much, Dr. George Haramis.
Thank you so much for having me.
Good to have you here. Okay, so I will say I am coming to channel. Yeah, dear cinema, Mr. Ocheme, me basisia.